This September, the United Nations will hold a high-level meeting on non-communicable diseases, the first on this important and complex subject in history. On Thursday, the General Assembly held an informal, interactive civil society hearing on non-communicable diseases designed to kickstart the discussion on the problems posed by NCDs.
The UN Summit in September is the podium where our voice can finally be heard, with a captive audience of the top world decision makers. In order for us to communicate our message most effectively and decisively, we need to be sure that we speak with one strong, united voice.
NCDs cause about 2/3 of all deaths, claiming 36 million victims annually. Of the 9 million premature deaths by non-communicable diseases each year, about 90% occur in developing countries, exploding the myth that NCDs are a problem of affluence. To overcome the problems posed by NCDs and ensure stable development in low and middle income states, the public and private sectors will have to collaborate and find innovative solutions.
As we have learned in our collective response to other health and development issues, success will depend critically on the ability of governments, the private sector, and civil society to form alliances and partnerships to address effectively NCDs. No one actor is able to harness the resources necessary or address the complex range of factors that are driving the progression of these diseases. We must work together, and we must find ways to do so more effectively.
Civil society has a fundamental role in promoting commitment on the part of government and society to the prevention and control of disease. And it is only with the very active, I would even say at times, only with the very strident participation and involvement of civil society that progress will be made.
One region where private-public partnerships have had a significant effect on limiting the destructive toll of NCDs is the Caribbean. There, governments and businesses have cooperated to reduce deaths by NCDs through educational programs and treatment. The Caribbean model for cooperation, along with the region's active efforts against NCDs led by organizations like CARICOM and PAHO, could serve as an example for other regional cooperation plans.
The response in the Caribbean to the NCDs has been one of high-level leadership from CARICOM governments and from civil society. But this leadership in collaboration with regional and extra-regional partners now needs to be enhanced. In the Caribbean, policies to improve quality and affordability of essential medicines for NCDs have improved. But again, these efforts need to be strengthened. The successes in these areas need to be evaluated to determine how best to strengthen and build on them.
When the high-level meeting on non-communicable diseases convenes this September at the General Assembly, the interaction between civil society and the government will play a critical role in determining the strategy developed to fight NCDs. Reporting from the General Assembly Hall at UN headquarters, I'm Connor Schratz for South-South News.